Hello everyone. In today's video we'll be talking about hypoxia. Okay, so let's begin. First of all, we need to understand what hypoxia is or what it means. Hypoxia means low oxygen delivery to the tissues of the body. Now, let's look at this picture here. Low oxygen delivery to the tissues of the body could happen due to two factors. Insufficient amount of oxygen supply, so the oxygen is actually not supplied to the body well enough, so it goes to the tissues, and insufficient utilization of oxygen. So the tissues or the cells of the body do have the oxygen, but they don't know how to use it. They don't know how to utilize it. And this could happen due to different reasons. And we'll be talking about them in a minute. So before we get deep into hypoxia, we need to understand the stages of hypoxia. So there are actually two stages of hypoxia. There's the early stage where the symptoms are very mild, which you can remember by remembering this word RATT, R-A-T-T. So the early stages of hypoxia symptoms are restlessness and anxiety, tachycardia, which basically means the heart rate is more than 100 beats per minute, and tachypnea, which is excessive breathing too much, too fast, or too hard. RATT. Those are the early stages of hypoxia. Now, the late stages of hypoxia, where you need to help the patient immediately because they'll probably be in the emergency department, is bradycardia, which basically means the heart rate is actually less than 60 beats per minute. So if we look at the early stages, realize that the patient's heart is bumping too fast, 100 beats per minute or more. But in the later stages, the heart is affected by hypoxia, and so it beats slower. It beats less than 60 beats per minute. Now, another symptom is extreme restlessness. What that means is that you are not able to move. You're very restless. And next is dyspnea, and lastly is cyanosis. Now, cyanosis is the most serious and most severe symptom of hypoxia. It's basically when you have blue skin or blue lips or blue fingernails. Now, those could be very, very obvious symptoms to hypoxia. Now, blue skin is it's this color because the skin or the tissue of the skin is not getting enough oxygen in order to function properly, so the cells are basically dying slowly. So now that we determined the stages of hypoxia, we need to understand the different types of hypoxia. So let's scroll all the way down here. First of all, there is hypoxemic hypoxia. What that means is that there's a decrease in the arterial pressure of oxygen, or to put it simply, there's not enough oxygen in the air or delivered to your body because the problem is in your lungs. So the causes could actually be two different ones. Number one is high altitudes. Let's assume you are climbing a mountain or you're on a plane, and this plane has rapid pressurization, or the oxygen would just leave the plane quickly. This would cause the plane to go into a stage where the level of oxygen within the plane, inside the plane, is equal to the level of oxygen outside of the plane. Now, if you go higher in altitudes, the level of oxygen actually decreases because oxygen is heavier than air, so it's low on the ground. Now, high altitudes, like I've mentioned, is a big reason why someone could have hypoxemic hypoxia. Another one could be pulmonary diseases. What that is that your lungs themselves has a problem that does not allow them to deliver the oxygen to the heart and then to the tissues of the body. Now, examples of those is the constriction of the bronchi or asthma. What asthma does is that basically you're breathing so hard, but your bronchi are blocked, so the air is not going through them in order to reach your alveoli or to reach your lungs where the exchange process happens, so you're not getting enough oxygen. Now, problems, this shouldn't be here. Now, problems with exchange in the alveoli could also be another problem. A disease like this is, for example, is emphysema, or a decrease in the surface area of the alveoli. Now, imagine with me, this is the alveoli. It's now smaller than it is. It got smaller, but those capillaries are far away from the alveoli. So the exchange is affected. So your body is not getting oxygen in the first place to function with. Another cause of hypoxemic hypoxia could be pulmonary edema. Now, moving on from the causes of hypoxemic hypoxia, let's go to a different type of hypoxia, which is the ischemic hypoxia. Now, let's assume that your lungs has no problem and you're on the sea level, you're on floor, and there's no problem with the oxygen outside in the air. your lungs got good oxygen, and then they pumped them to their heart. But then the left ventricle wasn't strong enough to bump the oxygenated blood through the aorta to the tissues of the body. What that means is cardiac output. So what cardiac output is, again, is basically your heart not being able to bump enough blood or bump hard enough for blood to go all the way to your body. Now, decrease in cardiac output would basically lead to your tissues not getting enough oxygen, which is hypoxia. Another reason could be a blockage in capillary beds. Now, let's assume oxygen is okay here, it goes to the heart, and it's okay here, and it gets pumped to your body. But here, there's a little blockage. Now, the mouse is a blockage. The blockage would not allow the blood to go to the tissues, therefore having the tissues not get enough oxygen to function. So this is ischemic hypoxia. What would lead to ischemic hypoxia? Another reason could be anemic hypoxia. Basically, what it means is that there's a decrease in the oxygen delivery due to two reasons: a decreased number of red blood cell or decrease of the hemoglobin. What it basically is that you have anemia, so you don't have enough red blood cells to carry the oxygen. There's no problem with the air, there's no problem with the absorption, but the problem is in the blood. It cannot carry enough oxygen to help the body function properly, so the cells starve for oxygen and then die slowly. Another cause could be carbon monoxide poisoning. Now, carbon monoxide poisoning is very bad because what it does is that the carbon monoxide molecules bind to the hemoglobin. Now, hemoglobin, imagine it like this: red blood cells, it has many hemoglobin molecules within. Now, every one of those hemoglobin proteins basically can bind 4 oxygen molecules. But if there is carbon monoxide is 250 times more likely to bind to the hemoglobin than oxygen. So it would take the oxygen's place in the hemoglobin, causing the oxygen to not know where to go and not bind to hemoglobin, and then not be in the red blood cells and travel through the body. Very, very bad problem. You're not getting enough oxygen in the red blood cells to go to the tissues. I hope that's clear. Last type of hypoxia is histotoxic hypoxia. Let's assume no problem in the air, no problem in the lung, no problem in the heart, and no problem in the capillary beds. Oxygen, and no problem in the blood in the first place. So the oxygen is actually here in the tissue, and it went to the cells. But the cells don't know how to use them because poisoning happened. Let's say someone got subjected to cyanide poisoning. What it does is that it inhibits the cytochrome oxidase, which in turn produces ATP. Let's assume oxygen is there, but the enzyme that uses the oxygen to benefit the body is not there. It's inhibited. So the oxygen is just floating around and the cell is basically dying. It's like suffocating because it cannot do anything with the oxygen giving. So oxygen is there, but it's not utilized properly. So for example, like I said, it affects on the enzyme mentioned here, the cytochrome oxidase. Now, we have gone through all of the different types of hypoxia. Let's look at something that is very important. Let's look at the ranges of hypoxia, or the numbers in hypoxia when it comes to numbers. Now, there are some terms that you need to be familiar with before we start. There is a partial pressure of oxygen. What that is basically the pressure of the oxygen in your blood. How is the oxygen traveling in your blood? Is it high pressure or low pressure? Next one is oxygen binding capacity to hemoglobin. Let's try to understand one word at a time here. Oxygen binding capacity of hemoglobin. So the capacity of binding of oxygen to the hemoglobin. If we look at this picture here, we said red blood cells, hemoglobin. The oxygen binds or sticks to the hemoglobin. How does it stick? How effective does the binding capacity stick? The maximum of it. The normal range. We'll talk about the values later. Next is the oxygen content in blood. We have, let's say we have a liter of blood. We want to know how much oxygen is inside of that liter. This is the content in blood. Now, oxygen saturation basically means the percentage of hemoglobin present as oxyhemoglobin. So we have the blood. There is oxygen here, 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 all the way outside of the red blood cells. Now, there are oxygen molecules that bind to the hemoglobin, like mentioned. So the value of that is calculated by the oxygen saturation level. Lastly, partial pressure of CO2. This one is not very important. We don't have to get through it in detail. So now, in order for us to determine the type of hypoxia a patient has, we need to understand all of those different values and if they're within the normal range, or they're low, or they're high. So let's look at them one by one. The normal range of partial pressure of oxygen in the lungs, PO2 lungs, is 100 mmHg. Now, the normal PaOH, now partial pressure, the A here refers to arterial. And let's just put a space here so it's more clear. And the V here refers to, if you guessed it, venous, within the veins. So the pressure of the arteries, the pressure of oxygen within the arteries, the normal range is 80 to 100. And the pressure of the oxygen in the veins, the normal range for it, or the normal number, is 40 mmHg. Now, those values are very important to remember, because if those values are not within the proper range, we can right away assume that if the person presented with hypoxia has hypotonic hypoxia. Another value that is very important is the oxygen binding capacity of hemoglobin, which is 20 ml/dl. This is a normal of it. Next is the oxygen content in blood, how much oxygen there is in the blood generally. Now, in the arteries, it should be 19 ml/dl, but in the veins, it should be 14. Now, if we look at this picture here, we know that hemoglobin has oxygen here, and all of the blood has oxygen here. It goes here, and then the cells or the tissues take the oxygen, and then it goes here. So there's less oxygen here than here. Now, the difference between the oxygen in the veins and the oxygen in the arteries is always 5 ml/dl. If it's not, then there's a problem. If it's low, then it's either hypotonic, hemic, or heterogeneous hypoxia. But if it's high, it's definitely circulatory hypoxia. The oxygen saturated, or the percentage of hemoglobin as oxyhemoglobin, the hemoglobins that have oxygen in them, in the arteries should be 95 to 98% of the oxygen being saturated. In the veins, 70 to 75%. Now, just look at this value. The normal value of the partial pressure of CO2 should be 35 to 45 mmHg. It's not very important to help us to determine this, so I'm not getting into detail. Now, let's look at an example of a situation here where a man, a 36-year-old, ate some white powder by mistake in the morning and then went to the emergency department. Now, the lab analysis, now we know he has hypoxia because the fingers and lips show a purple color. They did a lab analysis and it came out as follows. CaO2, so the CaO2 here is the oxygen content in blood in the arteries was 15 ml. Now, if you look here, 15 ml in the arteries. Oh no, something is wrong here. The normal is 19 and his is 15. So his is lower than normal. If his is lower than normal of the CaO2, let's look at what types of hypoxia have lower CO2 or CaO2. CaO2, the ones that have them are hypotonic hypoxia and hemic hypoxia. The other two, circulatory and heterogeneous hypoxia, have normal CaO2. So now we can assume he either has hypotonic hypoxia or hemic hypoxia. Now let's look at his other values. Let's look at, in particular, his PaO2, because if he has normal PaO2, it means that he has hemic hypoxia for sure. But if he has low PaO2, then this patient most likely, probably, has hypotonic hypoxia. Now let's look. His PaO2, or partial arterial pressure of the oxygen, is 99. Now let's look at it. Let's look at the normal average here. The normal average is 80 to 100. 99 is within that value. So we can assume that his partial pressure of oxygen is normal. If it's normal, and this is low, so now it's for sure that he has hemic hypoxia. All right, so now that we understood this, we can close this tab, and we can already assume what type of hypoxia it is. We can totally tell that it's anemic hypoxia, and this patient probably was subjected to some kind of carbon monoxide poisoning. Now, moving on to a less hard topic, results of hypoxia. What hypoxia leads the body to do? It's ischemia. You basically don't know what's going on, and necrosis. This one is very bad. It basically means reverse cell death. Basically, that cell just presses the self-destruct button and kills itself. Now, how to treat hypoxia? Each type of hypoxia is treated differently. Hypoxemic hypoxia is treated with supplement oxygen. You just give the person oxygen, more and more oxygen until they get to the level where they are normal again. Ischemic hypoxia, on the other hand, needs either surgery when there's a blockage, like we said here. Ischemic is either cardiac output not being well enough, so you need to do surgery on it, or blockage here, so you need to do surgery here, or you just give medicine in order to release the blockage or increase the cardiac output. Histotoxic hypoxia is treated by drugs. And lastly, anemic hypoxia, you have to first treat the anemia, more blood or more blood cells, and actually supplemental oxygen could help with anemic hypoxia. Now, a disease related to hypoxia could be the tardive cyanosis, or the VSD, which is basically a hole in the heart. It's basically when there is a hole between the left ventricle and the right ventricle, so the oxygenated and deoxygenated blood are getting mixed. So when the blood flows this way and then it goes to the body, the blood is actually not oxygenated. It's been through the cycle already, so the person would get hypoxia, or would happen to cause hypoxia. Now, very important diagram to look at are the difference in skin colors and mucosa with different types of hypoxia. I'm not really going to get into it much, but heterogeneous hypoxia would cause a bright red color. Circulatory hypoxia would cause a pale color of the skin. Anemia would cause a pale color. Carbon monoxide poisoning would cause a cherry red color. All of those are different colors that would result in, that hypoxia would result in. Now, that's all we have for today. I hope that was helpful. Thank you for sticking around with me. Goodbye.